Many victims of motor vehicle accidents suffer from brain injuries, commonly known as concussions or traumatic brain injuries. These can range from mild, moderate, or severe. Over 70% of brain injuries are considered mild. However, it's important to realize there's nothing mild about a traumatic brain injury. With me here today, I have Harpreet Sidhu,
Hello.
Russell Oloshi,
Right.
Daniel Berman,
Hey.
and last but not least, Ratumi Tank.
Hi.
So I think the way we're going to start our discussion today is I'd like to actually ask the panel about 4 common myths of brain injury, or what is also referred to as concussion or mild traumatic brain injury. So let's start with Danny.
Sure. Probably the biggest myth that we see regarding mild traumatic brain injuries is whether you need a loss of consciousness. And many think that a loss of consciousness is required, but it's in fact not. And this is supported by all the academic literature on the topic. In fact, the Ontario Neurotrauma Foundation's recent guidelines for mild traumatic brain injury specifically states that a loss of consciousness isn't required to sustain a mild traumatic brain injury. And as well, recent case law has affirmed this.
Excellent. Ratumi.
A common myth that we often hear is that in order for somebody to sustain a traumatic brain injury, there needs to be a blow to the head or some sort of impact. That is not the case. Oftentimes in car accidents, a lot of people experience whiplash. So their head moves back and forth at a very fast pace, which is enough for somebody to sustain a traumatic brain injury.
Okay, that's great information. Harpreet.
Yeah, and just to add on to the second myth that Rutumi mentioned, the reality is that when there is a whiplash, there's a rapid acceleration, deacceleration of the brain inside of the head that happens. And so when the brain is accelerating at such a hard pace, such a fast pace, those neurotransmitters are shearing and the brain is making that rapid and a hard impact with the exterior cortex. So that results in a concussion occurring in somebody, even if there is not an exterior impact that happens. A third myth that's very common is that there has to be an immediate onset of symptoms when somebody does suffer from a mild traumatic brain injury. The reality is that just like how everybody's body heals differently at a different pace, everybody's body responds differently as well.
That's great information. Russell.
I think one of the most talked about myths is that there has to be a diagnostic scan that shows the brain has been injured. That's really not the case for the most part when you're dealing with a concussion or a mild traumatic brain injury. The damage to the brain is not severe enough to cause a bleed and allow that to actually appear on a diagnostic scan such as a CT or an MRI. Some more specialized scans might be able to show it, but not usually, unless it's more severe or moderate to severe.
And that's important information because a mild traumatic brain injury doesn't generally show structural damage in these scans. But what we know from medicine is that we actually develop symptoms as a person who actually suffers from this. And let's talk about those symptoms because they're really important. And just for our viewers who've seen some of our earlier programs, we actually break it into 3 categories. We've got physical, we've got mental, behavioral, emotional, and we've got cognitive. So let's maybe start, Danny, maybe you can talk to us about one of those areas.
Sure, I can start just with the common physical symptoms that people have from a brain injury, and they can be nausea, the feeling of wanting to vomit, ringing in their ears, otherwise known as tinnitus, vertigo, dizziness, balance issues, headaches obviously is the most common one, but these are the kind of symptoms that usually appear following a traumatic brain injury. And as Harpreet said, it might not always happen in the first few days, it might happen a few weeks after, but they are extremely common.
Okay, great. Ratumi, maybe you can explain the cognitive impacts or symptoms that we generally experience from TBIs.
Yeah, so this is symptoms ranging from word finding issues to memory loss, short-term, long-term memory loss. Sometimes it's issues with speech, so stutters or things of that nature.
Okay, and then that would leave, maybe Harpreet, you can take on the mental behavioral.
Absolutely. There's mental behavioral symptoms typically consist of irritability, anger, anxiety, depression, and post-traumatic stress disorder, which can kind of also overlap with a couple of other physical symptoms such as sleep disturbances and fatigue as well.
All right. I think it's important that our viewers understand more. How do you become catastrophically, how do you get a catastrophic determination from a brain injury? Does that exist? Is there a special criteria you need to meet? Maybe let's talk about that, Russell. Maybe you can start.
Sure. The criterion that would deal with catastrophic brain injury from a brain injury perspective is kind of divided into two different sections. There's the criteria for minors, and then there's criteria for adults. So anyone under 18, there's a certain set of criteria. It starts with having a diagnostic imaging that confirms a brain injury. And with minors, it depends on where your child might be admitted into a hospital following their brain injury. And whether it's one type of hospital or not, it might automatically classify them as brain injured and therefore may be catastrophically impaired. Now, when it comes to adults, that's different. The criteria that we would go under is called the GO-C criteria, which is criterion 4. The testing is somewhat different, but in essence, it's what are the effects of the brain injury on your overall function, and it is measured at different intervals. So, for example, if you're still unconscious 30 days after your brain injury, which would automatically be a severe brain injury, then that will get you catastrophic impairment within that 30-day period or right after that 30-day period. So it really just depends on the severeness of the injuries, of the symptoms, as well as how long has it been since the injury itself. When is this severity actually measured? 6 months to a year and beyond. There are different criteria, of course, but that's the general sense.
In essence, most of our clients that come to the office are not just suffering from a brain injury. Sometimes they could be classified, they could have a mild traumatic brain injury, but they have a lot of other physical or mental behavioral symptoms. And I think it's important for the viewers to understand when you're actually suffering from a brain injury, that brain injury itself, because of the complexities of not being able to be classified. I mean, if we can't see an image that actually shows a brain injury, then you're pretty much, unable to be determined catastrophically impaired because we need that right imaging. But what other factors do we combine with a brain injury that can actually help somebody still become catastrophically impaired? Danny?
Yeah, so you can do an alternative to becoming catastrophically impaired with a brain injury is also looking at your physical and psychological impairments as well. And according to the American Medical Association guidelines, which is the book used to actually rate catastrophic impairment, they can rate different areas. So for example, with the brain, they can rate an area such as sleep, hearing, vertigo, loss of smell, and other types of areas. They will look at physical injuries such as an injury to your back or your shoulder, and they will also look at your psychological injuries as well, and then combine all of them.
And it's that combination that if you are able to get to a 55% whole person impairment, that will allow you to become catastrophically impaired, or you can be determined catastrophically impaired, and you don't necessarily need to be catastrophically impaired just on a brain injury. That's great information because often I think people misunderstand that piece. I'd like to thank everybody for joining me here today to discuss this very important topic. If you or a loved one have been involved in a motor vehicle accident and need support in managing your catastrophic determination or need assistance managing your accident benefits claim, we encourage you to contact Foisy Associates. We are a personal injury law firm that fights to receive maximum dollars for all of our clients. Thanks for tuning in, and we'll see you again in our next video.